Hi, I'm Dan Dixon here at Impact Sports Performance and Training, and this is John Gaunt. John Gaunt suffered a stroke 13 years ago, suffers from hemiparesis. So we're going to do a little bit of muscle testing today on him, and we're going to be doing some range of motion testing. So let's get started. So now that I've gotten John on the table, we're going to take a look at his passive range of motion on his right leg. And we could test both to see what his deficiencies are between one leg or the other. But I'm going to have him do a fair test first. So I'm going to ask John, go ahead and pull your heel toward your posterior there. Yes, as far as you can get it. Now, how does that feel? Does that painful?
No.
Not painful, just that's as far as you can get it. All right, good. So I'm going to come in here, and if you feel any pain, John, just let me know. I'm going to see if I can gently get that to go back any further. And that looks like that's all we're going to get right there. I'm going to see if I can bring it back even further. Is that painful? Causing you any pain?
No.
Good. All right, so we're going to take a look at the goniometer here. And I'm going to line the one side up with his femur. I'm going to get the other side right at the knee joint. And then I'm going to line the other side up, aimed right toward his lateral malleolus there. And there we go. And he has a total of about 114 degrees range of motion on this side. Now we're going to ask him to go ahead and straighten this out. We're going to take a look at the other side, because the one thing I've been working with John for about 3 months now, and the one thing we've noticed is a lack of range of motion. Go ahead, John, on your own, pull it back as far as you can get it. Good, good, good. And I'm going to see if I can passively get you to go back even further. Comfortable? Painful?
That's about it.
That's about it right there. All right, let's take a look and see where we are. So we'll line this up here with his knee joint. Line this up here with the femur. And we're looking at a range of motion of 122 degrees. 122 degrees. And on this side, again, let me write this down. Significantly more range of motion on his left as opposed to his right. Next, we're going to see if John's his knee joint hyperextends. So what I have is I have a weight propped under his ankle there, back of his ankle, and we're just going to get a 180-degree measurement there. And John, what I'd like you to do is press your knee down toward the floor as hard as you can. All right, and relax. And press this one down toward the floor again, toward the bench you're sitting on, and relax. And press down this downward. Ready? And go. All right, and good. And we're not getting any hyperextension at all. I'm not surprised. We might get some on this, so I'm going to take this out. Let me set this down. Take this out. Good. And we're going to put this here. Feel okay? And just relax this. Don't push down yet. So just have this relaxed right in here. And let's get a measurement straight here. All right. And go ahead and press your knee toward the floor. Yes. Very good. And relax. Good. And press down. Good. All right. And we're getting about a 4-degree hyperextension on his left, which is his unaffected knee joint, and on his right knee, we're getting 0. So not something that is unexpected from working with John for the past, 3 months. His range of motion on his entire right side is compromised. So definitely something that's not unexpected.